Hey there, everybody. Welcome back to Medigap Show. I'm Holly Cohen, licensed agent, and today we are going to dive deep into a topic that demands your attention, the nitty-gritty of Medicare Advantage plans. So buckle up and strap in because we are about to uncover some eye-opening truths. We've got an enlightening article as our guide today. It's all about the latest scoop on Medicare Advantage plans for 2023. So let's start by taking a closer look at why Medicare Advantage plans are becoming the new hotshot in town. According to the latest data from the Kaiser Family Foundation, enrollment in the Medicare Advantage plans has been on a steady rise, drawn in by the promise of comprehensive coverage. Let's now take a look at this article from the Kaiser Family Foundation. Medicare Advantage in 2023 Enrollment Update and Key Trends. Posted to the KaiserFamilyFoundation.org's website, Medicare Advantage enrollment has been on a steady climb for the past 2 decades, following changes in policy designed to encourage a robust role for private plan options in Medicare. After a period of some instability in terms of plan participation and enrollment, the Medicare Modernization Act of 2003 created stronger financial incentives for plans to participate in the program throughout the country and renamed private Medicare plans Medicare Advantage. So that's where they were born. In 2023, 30.8 million people are enrolled in a Medicare Advantage plan, accounting for more than half, or 51% of the eligible Medicare population, and $454 billion, or 54% of total federal Medicare spending. Wow. And $454 billion, or 54% of total federal Medicare spending. That's the net of premium. To better understand trends in the growth of the program, this brief provides current information about Medicare Advantage enrollment by plan type and firm, shows how enrollment varies by state and county. A second companion analysis describes Medicare Advantage premiums, out-of-pocket limits, cost sharing, extra benefits offered, prior authorization requirements, and star ratings in 2023. Let's go over now the key highlights. More than half, 51% of eligible Medicare beneficiaries are enrolled in Medicare Advantage in 2023. The share of Medicare beneficiaries enrolled in Medicare Advantage varies widely across counties. More than half of eligible Medicare beneficiaries are enrolled in Medicare Advantage in 2003. Check out this graph. Look, from 2007 to 2023, it has gone from 19% all the way up to 51%. Between 2022 and 2023, total Medicare Advantage enrollment grew by about 2.3 million beneficiaries, or 8%, a similar growth rate to the prior year, 8%. The Congressional Budget Office projects that the share of all Medicare beneficiaries enrolled in Medicare Advantage plans will rise to 62% by 2033. In 2023, nearly 2/3 of Medicare Advantage enrollees are in individual plans that are open for general enrollment. Nearly 2/3, 64% of Medicare Advantage enrollees, or 19.6 million people, are in plans generally available to all beneficiaries for individual enrollment. So that's what this graph right here shows. You can see distribution of Medicare Advantage enrollees by plan type. So I'm just going to take my mouse and highlight over. The orange shows the employer union-sponsored group plans. The green are the special needs plans. So those are people who are either have chronic needs due to health or are on Medicaid. That's 19%. Individual plans open for general enrollment. That's just everybody who doesn't get offered any type of retirement program or they're not on a special needs type of plan, 64% are on Medicare Advantage. And about 5.4 million Medicare Advantage enrollees are in a group plan offered to retirees by employer or union. While this is roughly the same share of total Medicare Advantage enrollment since 2010, which is 18%, the actual number has increased from 1.8 million in 2010 to 5.4 million in 2023. With a group plan, an employer or union contracts with an insurer, and Medicare pays the insurer a fixed amount per enrollee to provide benefits covered by Medicare. For example, some states such as Illinois and Pennsylvania provide health insurance benefits to their Medicare-eligible retirees exclusively through Medicare Advantage plans. As with other Medicare Advantage plans, employer and union group plans may provide additional benefits and/or lower cost sharing than traditional Medicare and are eligible for bonus payments if they obtain required quality scores. The employer or union, and sometimes the retiree, may also pay an additional premium for these supplemental benefits. Group enrollees comprise a third or more of Medicare Advantage enrollees in 5 states. Alaska, 99%, not surprising because there's not much. Michigan, 40%, New Jersey, 34%, Maryland, 33%, and West Virginia, 33%. More than 5.7 million Medicare beneficiaries are enrolled in special needs plans in 2023, double the enrollment in 2018. So just simply, let me just explain one little thing here. If you're on Medicaid and you have Medicare and Medicaid, it's called dual eligibility, and they're considered in this special needs group. So they are saying more than 5.7 million Medicare beneficiaries are enrolled in special needs plans in 2023, double that enrollment in 2018. So here's what's really interesting is people used to just have original Medicare and Medicaid if they had Medicaid. But all these extra benefits that you see advertised on television or that were advertised, and I believe they are starting to crack down on those commercials, they are geared specifically for these special needs people, the people that are on Medicare and Medicaid. That's who gets these extra benefits. And that's why the number has risen since 2018 when the ads really got going and started. And by the way, all of this is politically infused, and I'm not getting into any of that, but just know that. But enrollment in those special needs plans has increased by 24% just between 2022 and 2023, and accounts for 19% of total Medicare Advantage enrollment in 2023. This graph shows the share of beneficiaries enrolled in Medicare Advantage by 2023 by state. So the light blue is showing less than 20% in these 3 states, Wyoming, South Dakota, and North Dakota. 20%, Montana, Nebraska. 30% are these states, Kansas, Illinois, Iowa. 30 to 40%, Kansas, Iowa, Illinois, and Virginia, and also Vermont, New Hampshire, Massachusetts. Yep. So those have grown by 30 to 40%. Now these orange states here, Washington, the state of Washington, Idaho, Texas, Oklahoma, Arkansas, Mississippi, South Carolina, Virginia, New Jersey. So this is enrollment data starting at 2013 to 2023. So this is over the last 10 years, how much these have grown. So the orange, let's go over those. They have grown in those 10 years, 40 to 50%. So Washington, Idaho, Oklahoma, Arkansas, Mississippi, South Carolina, Indiana, and New Jersey. Wow. 50 to 60%. All this green right here, 10 years in the making, 50 to 60%. The states are Oregon, California, Nevada, Utah, Arizona, Colorado, New Mexico, Texas, Louisiana, my home state down here, Florida, Georgia, Tennessee, North Carolina, Kentucky, that's where I'm from actually, born and raised, Ohio, Pennsylvania, New York, Connecticut, and Maine. 50 to 60% in the last 50 to 60% rise of Medicare Advantage plans in the last 10 years. Wow. And then shooting all the way up over 60% are these bright red states of Michigan. Those are both Michigan. And Alabama. And then Hawaii. Oh my goodness, Hawaii. Hawaii is a complete Medicare Advantage state. There is no hospital in Hawaii that actually will even take your red, white, and blue card. It's complete managed care. The share of Medicare beneficiaries enrolled in Medicare Advantage plan varies widely across the counties and the states, as we just covered. Thank you for joining me today on Medigap Show. If you liked this informative content, be sure to hit the like button and always share with your friends. Feel free to subscribe to the channel and hit that bell icon so you're notified whenever anything new comes out about Medicare. I will be sure to report it. Until next time, as always, be well.